Hello from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. Later, we'll be hearing from State Senator Amanda Mays Bledsoe of Lexington. The Republican is involved in several issues as lawmakers are looking ahead already to the 2027 session. But first, Dr. Stephen Stack is here. He is the Secretary of Kentucky's Cabinet for Health and Family Services. He has broad responsibilities for human service programs. Stack's also Kentucky's former health commissioner, was a longtime emergency room physician, and he served as president of the American Medical Association. Thanks for coming. Appreciate it very much.
Thanks, Bill.
Really, it's this concern about this problem that we're having out here with this intestinal illness that prompted us to bring you in so urgently. From a Kentucky perspective, how tough is this problem with cyclosporiasis?
Yeah,
it's a long word.
Cyclosporiasis.
Okay, sporiasis.
But it's caused by cyclospora, which is this small parasite, and it's most commonly in fruits or vegetables. We have it every year, but we don't have this much of it. So there's a big outbreak happening around the country. Michigan has the most of it, but there's been an outbreak we think is linked between Michigan, Ohio, Kentucky, and West Virginia. Right now, it seems like lettuce is the likely culprit, but we're still trying to figure that out. It's hard because the parasite takes about a week to 2 weeks to incubate in people. So from the time you get exposed to the time you develop symptoms can be a bit of a gap. And because a variety of things can cause it, it's been hard to track down.
Those symptoms can be tough.
They are. So you can have profuse watery diarrhea, intense abdominal cramps, a real gassy feeling. It can last, if you're lucky, for just a few days, but it can last up to a month or more if you're unlucky.
As you try to trace this down, and again, obviously this is a national type issue at this point, how's that being done?
So we rely on disease investigators who actually receive reports, contact people, ask about their history, where they've eaten, where they purchased their groceries, what kinds of foods they've consumed, and then you try to find common patterns. This is a system that's across the entire country. We rely here in Kentucky on a partnership between local health departments who assist us, the state health department, and of course the CDC. It's been difficult because there have been federal cuts to these programs, and so the current federal administration has markedly impaired the Centers for Disease Control by cutting grants that they provided to states and also by cutting staff at the federal level. This is a great example for why it's important, actually essential for us to have a robust public health system so that when these things happen, we figure it out fast and reduce the risk of people getting sick.
Not believed to be transmittable person to person.
Correct. It's not person to person. You've got to get exposed to the disease itself.
Late in the week, you had some new numbers that came in Kentucky.
Right. So we've had nearly 200 cases reported, and I believe we've had about 108 that have now been confirmed. Normally, in a typical year, we'd only have about 35 confirmed. So this is a marked increase.
What does it tell you that's going on out there?
Well, things like this have always happened and can happen. It's really important, like I said, though, that we figure it out quickly so we can find the source. Until we know what farm or producer is the source of this, it's really hard to stop it because our food system is so integrated. Remember, we get foods from all over the world, all over the country, in different restaurants, different grocery stores buy from different places. So tracking down the commonalities and figuring out the primary cause is critical to being able to end these things as quickly as possible.
Are you concerned about public health having the resources to be able to do what it needs to do?
I am concerned.
Yeah.
Public health is chronically underfunded. We went through a period with the COVID era and then the immediate years after where we were beginning to see an investment in public health, strengthening the systems, investing in the technology. In the last year and a half, there's been a continued assault on public health, a reduction of the federal funding, and a diminishing appreciation for the real importance of these programs.
You're having to make some adjustments to Medicaid, and that's ahead of August 1st is when there's going to be a point that there will be changes. What will that include?
Well, the ones I think you're referring to pertain to the budget that was enacted by the General Assembly. So the budget did not include the funding that was necessary to maintain the current program at its current services and levels for the next 2 years. So we all know inflation causes things to go up, and healthcare inflation is typically higher. The money provided in the budget did not include the funding necessary to account for 2 years worth of inflationary growth. So we gave notice to a lot of providers in the Medicaid program that August 1st or as soon thereafter as we could administratively do it, that there would be a 4% fee reduction that we would pay them. I would caution the provider community, this will probably take months for the administratively feasible part, because we have to get federal approvals for some of these actions, and it's complicated. So August 1st or thereafter, we'll have to implement a 4% fee cut unless we find other options for funding. They will not be, these reductions, retroactive, so they'll only go forward from the day we tell people to the next point forward.
What do you think the impact will be? Will providers not be seeing some patients?
That's always a risk, and that's a very real concern to ours. The fees have to be sufficient to support the services that the healthcare provider provides. If we cut them to the point that that's not the case, then some may choose not to provide. Now, I will say the governor has done a lot these last few weeks using authorities that the legislature told him that he had to designate funds from underperforming or programs or services to other areas. And so he has infused extra resources into Medicaid and other programs at the cabinet that have helped to forestall some of the worst cuts, including like foster care payment cuts, which would have been really harmful to the foster care system.
As you know, that's how the legislature has responded to this, is by saying the governor has the flexibility to find underperforming programs and apply money in other areas.
Right, and I think this is interesting to be part of and observe. The legislature made that assertion. The governor commented extensively at his June 11th Team Kentucky update. The things that are being done now, following the guidance that the legislature apparently has provided, are not typical, and the governor acknowledged that, which is why we didn't do them before. But these steps that the governor has taken, I'm very grateful for. I believe that healthcare is a moral and ethical imperative, and it's a good business decision because it's hard for people to show up to work and school and the rest of their life and be productive if they're not healthy and well. The governor's gone even further, and he's very consistent the whole time I've known him about asserting that healthcare is a fundamental human right. So I'm very, very grateful for his commitment to this because it's hopefully going to help forestall some of the worst of these reductions.
Work requirements have also taken effect, and it means able-bodied adults 18 to 64 have to work or be enrolled in a community engagement of some sort for 80 hours to maintain their eligibility. How do you expect to see that play out? And you are in charge of compliance here, right? Right.
The cabinet is in charge of this both for Medicaid and also for SNAP, which is food stamps is the more common term people use. So those requirements already apply to the food program for SNAP. For Medicaid, they'll take effective January 1st of 2027. And so we've mailed out a notice now to all potentially impacted Medicaid beneficiaries to let them know that they will have to comply in order to renew their Medicaid coverage starting January.
Give our viewers some idea of the scope of your responsibilities. I mean, it is an incredibly large cabinet that you run.
Yeah, and I said this during COVID as a commissioner. First of all, it's a great privilege because this cabinet impacts the people of Kentucky everywhere. Every one of us benefits from the cabinet one way or another. But to put it in numbers, the cabinet has 9,000 full-time employees or associates. It's about $27 billion in economic activity over the course of this upcoming year. We run the largest health insurance program in the state, Medicaid. SNAP, which serves 500 to 600,000 individuals for food support. Over 100,000 people a month on the WIC program for women, infant, and children. And we run all the social services programs for child protective services, adult protective services, the behavioral health hospitals where people get admitted to when they're in acute distress. It's a lot of activity.
To those who say if you could be more efficient, if there could be less waste, that more could be done, how do you respond?
We always have an obligation to ensure that we don't support waste in our government programs or our private programs, quite frankly. But waste is not the panacea for these things. There are 4.6 million Kentuckians in this state, an alarmingly large number of whom do not make enough money at their jobs that they go to every day in order to pay for health insurance, put food on the table, and pay their bills. That's a problem in Kentucky where we continuously have about in the bottom 5 for per capita income. And that's why the governor's economic activities, where he continues to say getting good jobs in Kentucky and making this a really desirable place to live, is essential. Because the way you get people away from needing social services and healthcare supports is getting them good jobs that pay well and a living wage and give them health insurance to boot.
Are we getting healthier as Kentuckians?
Well, there was some evidence that we were over the last 5 or 6 years. Our standing in America's health rankings had improved. We had gone from the high 40s down into the lower 40s. But you know what, there's a real risk that can backslide now, because if we have more people off of Medicaid and they become uninsured, if we have more people hungry because they're tossed off of the SNAP program and they can't afford groceries for their house, we know all those things contribute to poor health and poor outcomes. So I am concerned we could backslide, but we're going to keep doing everything we possibly can with the resources we have. And I do believe that our continued efforts will make a positive difference.
School starts soon. What do you want parents to think about in terms of vaccinations, visits to providers, and just getting kids sort of in a routine to be ready to go back to school?
Well, I'll say the first thing is the Our Healthy Kentucky Home themes, right? So eat at least a few vegetables every day, fruits or vegetables, exercise at least 3 times a week, and reduce that screen time off all those devices, phones, tablets, computers, and be socially engaged with people. Do those things to stay healthy and well and set a good foundation. Also, make sure if your child's going to participate in school sports, they've had a school physical to make sure they're safe. See your primary care provider for that physical, and also to make sure your vaccinations are up to date. Vaccinations help keep kids in school and away from the doctor's office and home ill. So those are really, really important. And some good news, recently it was reported that our vaccination rates had dipped further, but the newest numbers that have just come in for the school year just concluded actually show we've gone up about 4 percentage points in the most common indicators. So folks, people are still getting vaccinated. We just need a few more of them to join the club.
Dr. Stephen Stack is the Kentucky Commissioner of Health, was the Commissioner of Health. You are the Secretary of Kentucky's Cabinet for Health and Family Services. The big job. Thanks for coming. We appreciate it.
Thank you, Bill. It's good to be here.
Senator Amanda Mays Bledsoe will be with us next on Kentucky Newsmakers. We hope you stay with us. Welcome back now to Kentucky Newsmakers, and it is summertime. The Kentucky legislature is out, but lawmakers continue to deal with issues for the next session that will start sooner than we know it in January. Turns out there's a budget surplus from last fiscal year. Will that lead to calls for another cut in the state income tax? Governor Beshear has expanded a pilot program for pre-K for 4-year-olds, but has been unable to get a lot of support for that in the legislature. What are the interim committees talking about? Data centers, a big discussion out there. Joining us is State Senator Amanda Mays Bledsoe, Republican of Lexington. Thanks for coming. Appreciate it very much.
Happy to be here.
Good to see you. What would you have people know about what goes on in these interim meetings in Frankfort and the preparations for the upcoming session?
Well, they're really important meetings. Every committee meets about once a month. They're joint sessions, so the House and Senate share those meetings. So it's a really good opportunity for people who have specific concerns or suggested legislation, topics of controversy, if you will, to get vetted. And it does it at one time. So you're not just mentioning it to the House or the Senate. You get both chambers kind of actively engaged and listening, kind of going through the issues. It's a wonderful time to prepare. And you often get a good sense of kind of where the challenges might be in implementing some of those conversations.
So often bills result from the information that's gathered in the summer.
Absolutely, and you get a chance to vet the bill. So someone may have a specific idea to address a topic, if you will, and then all of a sudden the more it gets vetted, the more you realize there's some unintended consequences, and you get to vet those before you come into session. So they're really important.
Well, data centers keep coming up as a big discussion. Local governments seem to be in the dark at sometimes about how exactly to proceed, and they get a lot of feedback from the public. They're sometimes asked to sign these non-disclosure agreements. That brings controversy. Should the state have a framework of laws in place as it regards data centers?
I think it's really important that the state has a framework for how local governments decide their economic development policy. And data centers are businesses. It is a strategy that some communities may decide to go and some communities may not. And one of the things we did in this year's, we did not pass official legislation, but Josh Bray worked very hard. I worked with him on some of that legislation in the House. And the Public Service Commission actually adopted quite a bit of what was in that bill, making sure that taxpayers aren't responsible if something goes wrong, making sure that the data center has its own water and infrastructure to pay for itself so that the taxpayer is not being shared with some of that burden. And so that's done by the PSC. They also have tariffs now in place to make sure that if a community goes that direction, that they have some guardrails in place. But it's really a local government's responsibility. Paducah has been a long-time nuclear site and nuclear community. That probably doesn't go over different parts of our state. I would say in Mercer County in particular, they've got great equestrian areas. They've got Shakertown Village, and so maybe that's not the best strategy for them, but it's really up to local governments to decide if that is a economic development strategy for their community or not.
And yet that cost shift is a big concern, right? That a data center would come in, that it would, not that their bills would go to customers, but that they would consume so much electricity that the provider might have to increase their facilities, and then that would be shifted over that cost.
Correct, which is why that tariff is so important, and making sure that when they apply for that with the PSC, that they have those protections in place. Because you're exactly right. We want to make sure that power grid is sustainable and can afford to have other manufacturing job and opportunities as well. And so that community really needs to decide how they want their strategy to be and where it's most effective. Carroll County has apparently said yes. They're looking at $33 million a year of increase to their public school system. So some communities are looking at it and saying, yes, we think it's appropriate, and some are saying no, and that's okay. Our job is to help make sure they have those guardrails in place.
When it comes to AI, you've taken an interest in that statewide. Do you think that that is the future, and that we have to prepare how that will be governed?
I do. And what's interesting about AI in particular is that I find people who are pro or against data centers are all using AI tools to create their advocacy and their graphics and their market. And I've laughed and said, that all takes power. All of it comes back to why data centers are so important for the future. If we're going to continue to consume the amount of power and energy necessary to have that race, if you will, we're going to have them somewhere. And so trying to figure out what's the best land use for those opportunities is really the conversation. I don't see people changing their habits on using AI in the future.
There's a state surplus at the end of the fiscal year. Came as a surprise to some. The governor credits the administration's management. Many lawmakers say it is proof that the income tax cut has not hurt the economy, but in fact may have helped it. I take it you would be in that second camp.
I would just say that the governor's administration predicted a couple $100 million shortfall in December. To say that comes from maybe watching the paper clips and the pencils is a little bit of a stretch. I think this is a direct result of the Republican General Assembly's attack on public policy, on tax policy, and we're seeing it play out, and it's playing out sustainably. I think we had a 4.5% growth in income tax, even though we had a reduction. That's tax policy in place, and it shows Kentuckians are embracing the idea.
Might Republicans push for another cut to the state income tax? I know the eventual goal is to eliminate it, but is this the time to make that next step?
I think we've got to be very wise and careful, and that's what you've seen from the General Assembly so far, is not a very far jump or a quick jump. It's being very responsible to govern effectively and efficiently and making sure that tax dollars are spent for the highest and good use, but also maintaining, putting more money back in your pockets so Kentuckians can choose where to spend their money. And we've seen the actual sales tax go up. People are spending more, which is a positive. And so I think you're going to see a very measured approach from the General Assembly to continue down that path, to be wise. And you may see some of those coming up, but we want to be very careful. You can go too far too quickly. And I think we're going to see some very thoughtful discussion, and I would say probably a lot of discussion about the income tax.
It sounded like there was about to be a proposal last year, and then, as you say, caution won the day.
Well, you got to be mindful of inflation and other costs around, especially with the federal government making some different decisions on what the burden might be for Kentucky. We're a very highly dependent state on the federal appropriations. And so being mindful of those changes having a direct impact on us will be higher than some other states. And so we're just being very, very wise and very measured. I think that's the responsible thing for taxpayers they expect of us.
The Beshear administration says there will be Medicaid cuts coming, and some of those will be hitting August 1st. And we had Secretary Stack was just with us on this program, and he has a lot of concerns about some, he says, who may be left without services. Republicans have pointed out that there was a large appropriation, but he says that it was not enough.
I think some would say there's never enough money in Medicaid, there's never enough money in the road budget. That still doesn't mean we need to provide for the services. Medicaid's a vitally important portion and service to many vulnerable Kentuckians. And I can say, as someone who probably read the House budget, the Senate budget, the governor's budget, I can tell you we put more money in Medicaid than the governor's administration did in the budget. But more importantly, we gave the governor what he's been asking for, which is flexibility, to decide which programs are most important and where he can move money to fund those services. And I really hope, this is a really difficult thing, I think, for Kentuckians. 18% of Tennesseans are on Medicaid, 22% of Ohio, 28 to 30 of Kentucky, way higher than our surrounding states. It's not something we can sustain at that pace. And yet we have to be mindful, people need this service. And I would really hope the governor would work with us to figure out maybe a way we could be a better partner with each other to do both.
The governor expanded eligibility. Was that a mistake in your view?
I think we'd be very mindful of that because it's designed for the most vulnerable. And the more you expand that service, the more costs you're going to have. And then it looks like you're taking those services away from somebody who maybe could have found a different path previously. And so expanded Medicaid is a cost. It's a cost that's growing. It's now the second largest piece of our budget for a state. That's not something that is going to be a revenue producer for us. It's not an empowering thing.
And yet Dr. Stack says if we do not sustain the programs, that there will be fewer people with health coverage.
Well, there's fewer people with lots of things, and health coverage is vitally important. But is it Medicaid? Is it Medicare? Is it private sector? The whole system is one that's been very challenging for many people. And honestly, I would love to work with administration. I think Kentuckians expect us to work together to find a way for people to have affordable health care. And right now, whether it's in Medicaid or the private sector, affordability is a real big challenge. And we've got to find a way to make it easier for Kentuckians to have health care.
Senator Bledsoe, what other issues do you see coming up in the 2027 session that'll be here before we know it?
It'll be here before you know it. There are lots of issues coming up. We're going to continue to talk about tax policy, continue talking about the budget and making sure that we're providing for the needs of Kentuckians. We've talked a lot about education policy in the last year. We've had a lot of challenges in that areas in Fayette County. And so I expect that to be another conversation about making sure schools have what they need to educate the next generation of Kentuckians.
We're hearing screen time for students is a discussion right now. Senator Lindsey Tishner has been leading a discussion on that during the interim right now. Is it a balance to strike between wanting the students to have access to technology but not that become everything in school? Absolutely.
It is a tension. And you can see even in AI policy, we can see that specific tools and apps, if you will, used for those who have disabilities or need some extra resources, it can be a great tool for them on a short-term basis. But we certainly don't want to raise a bunch of kids who have spent too much time on screen. I'm a mom myself. That's a battle that I face every day with my own kids, myself included, quite frankly. And sometimes I pick up my phone. So trying to be more mindful about keeping your face down and maybe learning from each other and having different skills. That's a balance every educator's going to have to find.
Do you think there's likely to be legislation on that?
It wouldn't surprise me with legislation. It certainly will be a topic.
Governor Beshear has expanded his pre-K pilot program to 2 more districts, so there are 4 now. The legislature's been reluctant to support pre-K. Are you watching to see how it goes, or is this something that you favor or oppose?
I think all of us believe in early education is important, especially in the early years. I was reading with my kids at 6 months old. They couldn't read. A year-old, setting a good example. Early education is vitally important, and we know that curious minds at 3, 4, and 5 lead to really good education paths for kids. And so it's really important. How we do that is really the conversation. And post-COVID, we really blew up the child care market. And how we've been spending the last several years putting it back together, if you will, to make sure it's sustainable and solid so that we can have a child care system. If you've got a 6-week-old, a 2-year-old, and a 4-year-old, and you move that 4-year-old out of the program, what is that mother supposed to do that summer when she's got 2 in daycare and 1 in a pre-K program that only operates 9 months of the year? So it's a holistic approach, and I applaud the goal of getting more kids educated earlier, but how we do that is going to be the conversation.
You spoke out earlier about the issues with the Fayette County public school system, especially when they proposed an occupational tax or an increase to make ends meet. Are you still concerned about the situation there?
I'm very concerned, and I think if you talk to anybody in Fayette County, they're also concerned. And it's not just about the superintendent or the school board or the administration, it is the system. And it's kind of what I hear from families and teachers and students is, what is wrong with the system in Fayette County? And why don't we have a real good solid trust right now? And it's been broken. A year ago we talked about having that open meetings law violated before the tax increase. They did the same thing just recently over Superintendent Ligon's conversation. Again, that does not help bolster the public trust. And right now there's not a lot between the system and the families in which Fayette Countyans live. And I am watching it closely. I'm not the only one. And I think we've talked a little bit about the school board. You know, they're the ones that have to hold the administration accountable. They're elected by Fayette County to do that, to be in the room, know the details, and put the system on track. And it is up to them to really ensure that we're doing a good job. And right now, there's not a lot of trust there.
Have less than a minute left as Senator Mitch McConnell continues his recovery. I thought back to you and how also you had quite a physical challenge and have over the last couple of years after being injured, after being kicked by a horse. Is there frustration in not being able to get back into service?
Always. And you know, Senator McConnell is a very private individual and does not share much about his private life, and hasn't for decades, and that has been his choice. But trying to share your own public journey or private journey publicly is a tension that we all manage, and certainly I've had to spend more time even last month at my home recovering from surgery. So it's a challenge to manage those two things, but I have no doubt that he has been actively engaged, even from maybe his own hospital room, just like I have been. My cell phone still works.
Senator Amanda Mays Bledsoe, thanks for coming by. We really do appreciate it.
Thank you.
All right, everybody, stay with us. We'll wrap up Kentucky Newsmakers. A word about next week's program in just a moment. Welcome back to Kentucky Newsmakers, and a word about next week's program. We expect to hear from Rocky Adkins after what is expected to be a major announcement from him at midweek. And Kentucky Attorney General Russell Coleman will be with us, always making lots of news. We do appreciate you being with us for this edition of Kentucky Newsmakers. Stay with WKYT on air and online for the latest, and we hope you make it a good week ahead.